welcome to the Rest Easy Expo podcast. I am your host, Holly, and today I am joined by Dr. Kariana Patel, who is a vendor and guest speaker joining us at our expo in August. So first of all, thank you so much and welcome.
Thanks for having me. Really excited to be part of the event.
That's great. So you are a qualified dentist, but you specialize in sleep disorders, breathing. So can you tell us a little bit about that, please?
Yeah, so essentially, yes, I started off as a regular dentist, normal drill and fill kind of situation, but I kind of thought from the outset that there was more to it, and that there's more potentially things that we can see that as a dentist maybe aren't really mainstream, and that is sleep breathing disorders. So there's multiple different things that dentists are actually taught to write down in a clinical exam, but you're not necessarily taught about what to do with that information. So things that you can see directly would be like enlarged tonsils, large tongues, narrow palates. All of those sorts of things are actually signs of a narrow airspace. So narrow airspaces can essentially lead to worst case situation, would be something like obstructive sleep apnea, which is something that's mentioned quite a lot these days. Felt like for years no one was talking about it. But yeah, so we're pretty much like at the front line of seeing those things. In a regular checkup, you're seeing someone every 6 months. So it's really, really easy for us to pick up on those things.
That makes so much sense. That is what you're sort of direct viewingly there. Okay, right. Okay, so you and yourself and Sarah Beach are founders of Sleepwell Australia New Zealand, and that's an online platform. So what do you do there?
Yeah, so I have in the past run 3 sleep centers. So we did everything from like testing for sleep apnea, insomnia type symptoms, narcolepsy. So basically a whole range of different sleep disorders. And I had 3 of those. So I had one in Dubai, one in the south of England in Devon, and then one in London. And I moved to Australia around COVID time. Well, by accident, I was stuck here for 4 months. So I was
Not a
out
bad
for a
place.
conference. I know, it's the best place to be. So, but I kind of realized how hard it was to access healthcare during that time. And I did a bit of work for the National Health Service back in the UK, kind of dealing with COVID patients and everything. And I decided at that point it was a good idea to have more education out there for everyone to reach. So that's why the following year, kind of Sleepwell Australia New Zealand was founded. So I decided to stay. And then I'd met Sarah some years back and she kind of had like similar ideas. So I approached her as well. And yeah, so it's basically a platform where you can get a lot of different information, but not just from one speciality, because sleep affects so many different parts of your health. It's important for different clinicians to be able to collaborate. And that isn't currently being done massively. So we're trying to create something where clinicians can talk to each other, but also patients can find them. So we'll see how that goes. But there's a lot of information on there. Some of it's free, some of it is subscription based. But yeah, there's a lot of content on there at the minute.
Yeah, I had a look. So you've got webinars and talks and access, like you say, to other practitioners, which is really useful. And like you say, that it's a new sort of concept that people are getting their head around. We just used to think that snoring was what some people did, and it wasn't anything more than just snoring. So now we're
Yeah.
learning so much more, and it is becoming much more mainstream that this is really beneficial because it affects a lot of people.
Yeah, there's a lot of people. I think we did a lecture in Melbourne over the weekend, and I should remember the stats because it was so close to today. So I think it affects, I think it was like 436 million Australians or something like that a year. And that's just the sleep breathing disorders. And there's a whole range of different sleep disorders. And I'm just dealing with like one part.
Yeah.
So
And if you
yeah.
think about how fundamental sleep is, like it affects the diet choices that we're making, it affects our moods and emotions and how we interact with other people. If we're not getting enough sleep through something like a breathing disorder, it just filters through the rest of our life and our well-being and our health. So being able to talk to you or other practitioners and find out more and get to the bottom of it, like the root cause of it, and sort of solve that. It's such a crucial thing.
Yeah, definitely. There's loads of different things that you can do to kind of mask symptoms these days. But definitely the whole like diagnostic part of it is so important because some people, like you say, they could think that they just snore, but they might actually have like a serious underlying condition that they're just unaware of because no one's ever asked them or ever even questioned it.
Mm.
Snoring is for the most part considered normal, and it's not. So
Yeah.
yeah, and it can creep in as you get older because you do lose elasticity in your muscles and things. So it is quite common then that soft tissue can actually vibrate and cause that sound, but it shouldn't ever be dismissed as potentially nothing. So yeah.
And in particular, the talk that you're going to be doing at Rest Easy Expo is looking at the signs and symptoms of sleep breathing disorders in adults versus children. So what can you just tell us briefly about what those differences might look like?
Yeah, so for an adult, it's pretty easy to see when they're tired, right? Like you feel lethargic, you feel pretty like groggy, concentration lapses, all of that kind of thing. But with children, it's a little bit different. So they actually get a surge of adrenaline, they act super hyper. So it's a completely different situation for a child versus an adult. There's things that you can see in children, and I don't want to obviously like scare a lot of people because it does require the diagnosis as well. But you know, certain symptoms or signs that you might see are like dark rings under the eyes, drooling on their pillow at night, irritability, like I said, difficulty concentrating, might be that they've got poor performance at school, wetting the bed, all that kind of stuff. And then with adults, it's more of your like they're finding that potentially like memory consolidation issues, and other health issues that that kind of creep in alongside that. But as I mentioned at the beginning, there's visual things that like we can see pretty much as soon as someone walks in, which is pretty scary. But you can kind of see straight away, like if they've got a narrow nose or their face is quite narrow, if and even things like their neck position or like how kind of hunched over they are. Sometimes that's trying to get more air in because it's less of an angle when you're sitting up straight. If you already have an obstruction, bringing your neck forward actually helps get that air in easily. So there's different things that we can see, but yeah, there's a whole bunch of them. So I'm excited to delve into that a bit more at the expo.
Yeah, wow, that's fascinating. And I wonder how many children, especially, are being misdiagnosed with behavior problems,
Yes.
ADHD, and things like that. Because
Yeah.
I never knew. I wouldn't have known that if I hadn't been sort of looking into it and obviously from talking to you. But I wonder how many parents would have even considered that that is an option that they could take to
Yeah.
go to the dentist and actually have someone have
Not
a
very
look.
many, to be honest, because so I have a baby in daycare. She's 18 months at the moment. And every talk that we do or every webinar that we do every month, daycare is so interested to know more about everything because nobody really knows this stuff. It is published, it is research based, but it's just not out there. So yeah,
So this is really exciting that you're going to be joining us and that we can sort of help the residents and people of Brisbane to learn more and
yes,
educate. And that's very much about what the expo is all about, is helping to bring facilitators and practitioners and businesses and people together so that they can learn how to support themselves. They can change their mindset on how they look at sleep and rest and self-care, and they can have access to this information and this knowledge that you've got and wanting to get out there. So once again, like,
yeah.
thank you so much for joining us in August. We're super excited to have you. Tickets and everything will be available in a couple of months, but it is on Saturday, the 24th of August at Brisbane Technology Park Conference Centre, and we'll be going from 10 till 3. We're going to be joined from various vendors, speakers, and all sorts of people in the whole realm of sleep relaxation and self-care. So once again, Dr. Kariana Patel, thank you so much. It's been a pleasure to talk to you, and I can't wait to meet you in person at the expo.
Sounds good. Can't wait.